I'm Dr Christos Apostolou. I'm an upper gastrointestinal, pancreatic and liver surgeon at the City Adventist Hospital. Endoscopy, and in particular upper gastrointestinal endoscopy, has really increased the scope of our care of patients with diseases of the foregut. It allows us to investigate the esophagus or gullet, the stomach, and the duodenum in close scrutiny. The advantages are really where we would consider doing open or more morbid operations in the past. We can investigate these conditions with minimum risk, and we can derive a lot of information and often treat patients with problems of the upper gastrointestinal tract. The important things to mention would be investigation of patients with reflux. These are patients that may have a hiatal hernia, and really the important point here is to exclude premalignant conditions such as Barrett's esophagus, which is prevalent in men over 50 of certain ethnic and social backgrounds, and it's important to detect to prevent progression to cancer. Other conditions to detect would be gastric polyps, gastric ulcers, and less commonly duodenal pathology. We can also use endoscopy to enter the biliary tree. This is a more invasive test called endoscopic retrograde cholangiopancreatography, and this allows removal of stones through the biliary tree, which in past would be done with this big operation, and also allows stenting and decompression of bile duct in patients with more severe disease such as cancer. From the point of view of risk and trouble or morbidity to the patient, it's very acceptable. In particular, upper gastrointestinal endoscopy requires very little preparation other than starving for approximately 6 hours before the procedure. The patient has a general anesthetic, so they feel nothing during the procedure. We can look at the whole upper gastrointestinal tract. We can remove polyps and even small tumors that are related to a stalk or a particular favorable location, and often have significant advantage to further management through the information that we get from the endoscopy. For me as a surgeon, this is really opening new worlds to have this endoscopy available, and it allows us to fully investigate the patient. It can minimize the risks to the patient. It really can give reassurance as well, which is very, very important. And it really opens up the scope that we have for treatment, in particular for patients with potential malignant disease of the esophagus and stomach.